everyone. Come to Unacademy. Let's crack NEET. I'm Dr. Shilpa Dinesh. I'm a practicing pediatric consultant and educator in Unacademy. I have an experience of teaching undergraduate and graduate medical students. I've done my MBBS and graduate. So today we'll be discussing about a diamond Blackfan syndrome. So it is a congenital red cell aplasia. Okay, so along with that, I'll be doing another short topic, that is an acquired red cell aplasia, that is a transient erythroblastic anemia. Okay, so now we'll discuss today. First topic is diamond Blackfan anemia. So before that, I would want to talk a little bit about Unacademy. Unacademy is India's largest online learning platform, and there are a lot of benefits you can avail from this platform. Firstly, the daily live classes. There are various educators in this platform, and you can attend your favorite educator's class, any discussion, ask your doubts, and all these doubts will be immediately answered in the live chat box. Next, coming to the structured course. So whenever you're preparing for your entrance exam, you need to have a structured approach. You need to plan really well. So by the time you give an entrance exam, you would have revised very well, right? So here in Unacademy, all our courses are structured in line with your exam syllabus, and this is going to be a huge boost for your preparation. Next, coming to the live test and quiz. So again, whenever you're preparing for your entrance exam, you need to evaluate yourself. You know what is your strong area, what is your weak area. So that is possible only to attend as many tests and quizzes as possible. So here in Unacademy, you can evaluate yourself regular tests and quizzes which are conducted in this platform, and this will help you to analyze your performance better. Next, coming to the unlimited access. So once you subscribe to the subscription, you get access to all the classes which is exclusive to the subscription platform. So over here, even if you have missed a live class, you can go back and watch the recorded classes again and again, all this in the comfort of your home, in the comfort of your own device. So I highly recommend this platform, and using this platform in the beginning part of your preparation to a long way. So these are the top educators, and they have regular classes here. So you can attend their classes as well. And all the 19 subjects required for NEET preparation are taught in this platform. So and also there are various courses like the batch course, the foundation course, crash course. So you can see all these courses in the Unacademy app, and then you can subscribe to the subscription and these courses. Okay. This is a NEET PG subscription package. So as you can see, the NEET subscription package varies from 1 month to 2 years. So I would suggest the 1 year and the 2 year subscription, especially for the students who are in their third year, final year, or in their internship, right? So they do not have that much time to sit in front of the phone or in front of the laptop and only do your preparation. So your since time constraint is there, that's why the 1 year or the 2 year subscription becomes very reasonable. Another thing is, again, this NEET PG preparation is a 1 year long preparation. This will be very helpful for the students who are giving their NEET 2021. For them, the 6 month subscription is good enough. The 6 month subscription costs 20,000, and using my code Shilpa 10, you get a 10% discount, and it will come up to 18,000. Okay, and the 1 year subscription and the 2 year subscription. So the 1 year subscription costs 25,000, and using my code Shilpa 10, you get a 10% discount, and it will come up to 22,500. The 2 year subscription costs 30,000, and using my code Shilpa 10, you get a 10% discount, and it will come up to 27,000. Okay, so I highly recommend this platform, and using this platform in the beginning part of your preparation will take you a long way. Fine. So today we'll be discussing the first topic for today is the diamond Blackfan anemia. So that is a congenital hypoplastic anemia. Okay. So this is a red cell aplasia. So the other lines are not decreased. Over here the RBCs are decreased. Okay. So there is red cell hypoplasia. So over here these children are symptomatic within the first year of life. Okay. So they're in the early infancy. So they become symptomatic in early infancy. Okay, and the anemia over here is a normochromic macrocytic anemia. So remember, macrocytic anemia, normochromic macrocytic anemia, and these children have reduced reticulocyte count. So you should how they will present. Okay. So now coming to the etiology. So what is the gene affected? Yes, very good, Aparna. It's a pure red cell display. Yes. Now coming to the etiology, which is the gene affected in Diamond-Blackfan syndrome? Which is the gene affected in Diamond-Blackfan syndrome? So that is called as the RPS19. Okay, so this codes for a protein for the small ribosome. Okay, so this codes for a protein for the small ribosome. Okay, small ribosome subunit. Okay, yes, very good, Aparna. Okay, so the gene is the RPS19, and this codes for a small ribosome subunit. Okay, so this you should keep in mind. And the inheritance. So what is the inheritance of Diamond-Blackfan syndrome? So tell me the inheritance. So the inheritance is autosomal dominant. Okay, so the inheritance is autosomal dominant. Next. So next coming to the clinical features. So you should know that. So this Diamond-Blackfan syndrome is not very common, but you should know, you shouldn't get confused with aplastic anemia. So this is a pure red cell dysplasia. Okay. So next. So coming to the clinical features. So first you know that this presents in a very early infancy. Presents in the early infancy. So by 2 to 6 months of age, these children will present with anemia. Yes, very good, Aparna. It is autosomal dominant of age. Okay, so this you should know. So how do these children present? So they'll have craniofacial abnormalities. So what are the craniofacial anomalies these children will have? What are the craniofacial anomalies these children will have? So when you look at these children will have hypertelorism. So a widely spaced eye they'll have. Okay, so they'll have hypertelorism. Okay, they'll have a flat nasal bridge. Okay, also they will have a high arched palate. So I have a next slide which shows all the clinical features in the various systems. So now basic very important thing is the craniofacial anomalies you need to know. Yes, microcephaly will be there. Yeah, very good. So craniofacial anomalies you have to know. Next is the skeletal abnormalities. So tell me, what is the skeletal abnormalities in the other bones? What are other skeletal abnormalities? So craniofacial anomalies are very important. Next is the skeletal abnormality. So the skeletal abnormalities, the main is the thumb abnormality. You see in these, in the thumb, remember the thumb has triphalangeal thumb in these children. Triphalangeal thumb. Remember, these children will have triphalangeal thumb, or they could have a bifid thumb, okay, or they could have a thumb which is duplex. So bifid thumb they can have, okay. So this you should remember. So there will be abnormalities a thumb, and also the genitourinary system, okay, genitourinary system, cardiac system, eye symptoms, ophthalmoplegic symptoms there. So I will be showing it in the next slide. Okay, so this you should know. So first thing in a Diamond-Blackfan anemia is craniofacial abnormality. Okay, so these children will have hypertelorism. So there will be widely spaced eyes in these children. Then the nasal bridge, they'll have a broad flat nasal bridge. Okay, they'll have a broad flat nasal bridge. Next, they'll have cleft palate and a high arched palate. So remember, they'll have high arched palate. Remember the three micros. They'll have microcephaly, they'll have micrognathia, and they'll have microtia. Okay, they'll have small ears. So they'll have microcephaly, they'll have micrognathia, and microtia. And then along with that, they'll have low set ears. They'll have low hairline. They'll have epicanthal folds, and they'll have ptosis. So remember, these children, main thing is the craniofacial abnormality you have to keep in mind. Main thing, they'll have hypertelorism, they'll have a flat nasal bridge, they'll have high arched palate, okay, they'll have microcephaly, micrognathia, microtia, they'll have low set ears, low hairline will be there. So remember, these are the craniofacial features features of a child with Diamond-Blackfan syndrome. Okay. Next, coming to the eye features, eye symptoms. What are the ophthalmologic features in these? So these children will have congenital glaucoma. Okay, these children can present. So most of these children will present with anemia from the time of birth. Okay, and some children might have death as hydrops fetalis. Okay, so now from the time of birth, children can have congenital glaucoma. There can be strabismus or there could be congenital cataract. So remember, they can have glaucoma, they can have cataract, they can have strabismus. In the neck, there are various deformities these children can present with. Okay, they can present with a short neck, they can present with a webbed neck, they can present with a sprangle deformity, or they can present with a clipple failed deformity. So what is sprangle deformity? What is sprangle deformity? So basically, sprangle deformity is over here there is a deformity at the shoulder. So one shoulder is above the other. So one shoulder is higher up than the when compared to the other shoulder. So that is sprangle deformity. What is clipple fail deformity? So in clipple fail deformity, what you see is the cervical vertebra are joint, and there is and as a result there is the neck will look short and there is not much extension happening in the neck. So I have a picture of that as well. I will show you. So there is I will show you the picture of sprangle deformity and clipple fail deformity. So I'm not saying all these children will have it, but these are the few deformities they can have. So more of skeletal deformities. So one is the craniofacial, you should know. Then there is ophthalmologic, and next is the thumb. So what can be there? So main important is the triphalangeal thumb in these. So we'll have triphalangeal thumb. Yes. Okay. So the triphalangeal thumb is there, and either or else they can have a bifid. So there can be two thumbs, bifid or a duplex thumb. Fine. Or the thumb can be hypoplastic. Okay. Next is the thenar eminence. So the thenar eminence might be flat. Okay, they might have a flat thenar eminence. So everything related to the radial aspect. So either the thumb will be affected, or the thenar eminence will be hypoplastic, or it will be flat, or there will be absent radial artery. Okay, so you should remember this. Fine. Flat thenar eminence and an absent radial artery. So when coming to the urogenital system, so what is the main thing you know in the urogenital system? Same thing, similar like Fanconi anemia there is. So basically one thing you should say, most of the hematological disorders when it comes to the urogenital system, they have a similar presentation. They have absent kidney, or it could be horseshoe kidney, or it can have hypospadias. Okay, so in the urogenital system, these children can have an absent kidney, or there could be a horseshoe kidney, or there could be hypospadia. Next, coming to the cardiac defects. So these children can have various cardiac defects. Okay, so they can have BSD or ASD or coarctation of aorta, or there could be complex cardiac defects. There could be multiple cardiac defects. Okay, so these children have complex cardiac defects. Other important is they'll have growth retardation. So they'll have short stature. So I remember Aparna telling in one of the classes, I think in Fanconi anemia, the Diamond-Blackfan syndrome has short stature. So yes, these children have they have short stature. Okay, so Diamond-Blackfan syndrome, these children have commonly short stature. So they can have syndactyly. What is syndactyly? Syndactyly means the fingers will be fused. There will be fusion of fingers. Okay, there will be syndactyly. Fine. And also these children can have learning difficulties. Okay, so you should remember. Fine. So Diamond-Blackfan syndrome, there is hypertelorism. So the craniofacial abnormality you should remember, short stature you should remember, and the thumb features you should remember. So these are very important. And triphalangeal thumb is very specific for this. Okay, triphalangeal thumb. Fine. So this is the picture. Okay, so now this is the picture. What am I showing in the first picture? So over here you can see certain abnormality in the face. Okay, so the eyes also, so you can see ptosis in one side, the eyes also appear, they're widely spaced. So there is hypertelorism. There is ptosis also in this type. So next, this is a picture where you can see there is fusion of this bone. There is fusion over here. So this is a deformity called the clepal tail deformity. Okay, so there is fusion of the cervical vertebrae, and as a result, these children cannot extend or flex the neck that well. Okay, yes. So Aparna, you're right. There is ptosis. Fine. Next, so what is this deformity? So what did I say? A deformity where one shoulder is above the other shoulder. What did I say? So that is the Sprengel deformity. Sprengel deformity. Okay, there is this Sprengel deformity. Fine. So this is about the, yes, very good, Aparna. Right, right. More than, yeah, one is drooping, one is above. Okay, so that is the Sprengel deformity. So very good, Aparna. So yeah, so this is about the clinical features in a child with Diamond Blackfan syndrome. So now coming to the laboratory findings. So what do you see when coming to the laboratory findings? What do you see? So when you get a CBC, what will you see? So when you get a CBC, you will see there is severe anemia. Okay? They'll have severe anemia, and the platelets they'll have thrombocytosis. So why is there thrombocytosis? So there is a, what is it? Uh, there is a theory that since there is anemia, there is high stimulus for erythropoiesis through erythropoietin or thrombopoietin. So as a result, these children will have thrombocytosis. Rarely there is, rarely there is thrombocytopenia. Okay, so you should know in a child with Diamond Blackfan syndrome, the red cells which are affected, and there will be thrombocytopenia, and rarely there is sorry, there will be thrombocytosis, and rarely there is thrombocytopenia. So when you get a peripheral smear of these children, okay, there is anemia. When you get a peripheral smear, what do you see? So I've already said the peripheral smear, they'll have normochromic macrocytic anemia. Normochromic macrocytic anemia. Okay, so macrocytic. So in that, so when there is macrocytosis, the approach to anemia class, what did I say? You know, see if there is hypersegmented neutrophils or not. So when there is hypersegmented neutrophils, it could be megaloblastic anemia. But in these children, there is no hypersegmented neutrophils. Always, when a child has a peripheral smear showing macrocytic cells, you have to check for hypersegmented neutrophils. A presence of hypersegmented neutrophils will give you a hint that this could be a megaloblastic anemia. Fine. So there is no hypersegmented neutrophil. So another very important is the RBC enzyme. So at the erythrocyte deaminase adenosine deaminase, erythrocyte adenosine deaminase is, this is very, very important. The important point for this disease, this erythrocyte adenosine deaminase is elevated. Okay, so it's increased. So erythrocyte deaminase, adenosine deaminase is increased in this child. So a child who has a pure red cell aplasia, and when you get an RBC enzyme, that is the erythrocyte adenosine deaminase, you will see that is elevated. Okay, so this will help. So this will help in differentiating the other differential which I will be talking, that is the transient erythroblastic anemia. So in that it will be normal. So over here it is increased. Okay, so that is a differentiating point. Okay, so one more thing, and another thing is that reticulocyte count is low. So basically the RBCs are not getting produced. So that is why reticulocyte count will be low, right? So reticulocyte count is, so remember. So Diamond-Blackfan syndrome, you should know this. What is the peripheral here? What is the erythrocyte adenosine deaminase? And next is the reticulocyte count. This you should know. So differential diagnosis, I have told you the transient erythroblastopenia of childhood. So I have a slide in this. I will discuss about this. Okay, this is a transient erythroblastopenia of childhood. This is an acquired cause of red cell aplasia. Fine. So there are two things you should know. Yes, yes, they'll be later. They won't be born with that. Yes, very good, Aparna. So only anemia is present at birth. As the child grows with this abnormality, they will develop the skeletal deformity. Exactly, very right, Aparna. Okay, so they will not be born with these skeletal deformities. Okay, Aparna. So coming to the treatment and prognosis. So what is the treatment child with Diamond-Blackfan syndrome? What is the treatment? So the treatment is they'll give corticosteroids, or you give high dose corticosteroids. Okay, so you start with corticosteroids, and then by 1 to 3 of therapy, you will see there will be increase in the reticulocyte count. Okay, and once there is increase, then you have to maintain a low dose corticosteroid should be given as maintenance. Okay, this is corticosteroid is given. So in children where the corticosteroid doesn't work, okay, in children where the corticosteroid doesn't work, you will have to give blood transfusion. Okay, blood transfusion. Blood transfusion in where the corticosteroids don't work. So blood transfusion is given so that the hemoglobin is above 8 gram per deciliter. Okay, but problem with blood transfusion is, there is iron overload. So you have to keep checking for the ferritin and go for chelation therapy. And finally, you go for the best cure for this is hematopoietic stem cell transplant. Hematopoietic stem cell transplant is the cure for Diamond-Blackfan syndrome. Okay, you should the best is the HLA matched sibling donor is the best donor. HLA matched sibling donor. Okay, so this is the treatment for Diamond-Blackfan syndrome. So another thing is about the prognosis. So these children, so 25% of these patients go for remission by 25 years. Only 25%. So most in that 25%, yeah. So this thing you should know. Another thing is in the prognosis, you should know that. One second, I did a mistake. So just remember that 25% go for remission by 25 years. Another thing is about the prognosis. What you should remember is these children have a high propensity to develop cancer. That is the acute myeloid leukemia. Okay, so the acute myeloid leukemia. This you should know. Okay, so the next slide is on the transient erythroblastopenia of childhood. So this is an acquired cause of red cell aplasia. Okay, so this is seen in a child who was normal before. Okay, so this is generally not seen at birth. So the child is normal. Okay, the child is normal, and slowly by 6 months to 3 years, these children will present with anemia. Okay, so this is seen in a normal child. Okay, eventually going into anemia. Okay, so the main thing you should know is this is transient. So in the name itself there is transient. Okay, so this will the child will improve on its own. So again, when you get during the episode of anemia, when you get the CBC, you will see decreased RBC, There could be thrombocytosis. Okay, there is thrombocytosis, and in some children, around 20%, you will see neutropenia. Okay, and when you get a erythrocyte adenosine deaminase, this will be normal. So this is the main thing to differentiate transient erythroblastopenia of childhood with Diamond-Blackfan syndrome. So the erythrocyte adenosine deaminase is normal, and you do not see the skeletal abnormalities as you see in Diamond-Blackfan syndrome. So no skeletal abnormalities. And main thing, the child will be normal from the beginning. So the child will be normal. So these children can present somewhere between after 1 year. Okay, so the anemia is slowly progressing. So sometimes what happens, this might even get missed because one transfusion and the child will be all right. Okay, so the treatment is blood transfusion, no corticosteroids. Okay, so there is blood transfusion. So when a child who has been diagnosed with transient erythroblastopenia of childhood, and this child requires recurrent blood transfusion, then you have to think about other causes. Okay, so the blood transfusion is so in a single transfusion, then the child becomes fine. Okay, so this is transient and recurrence is very rare, and if the child again comes with a blood transfer for the need of blood transfusion, then you have to think about other causes of anemia. Okay, so now I will fast go through the two slides, and I will now after that I will discuss the previous topic. So basically you people have to answer me the question. Fine. So now, Diamond-Blackfan anemia is also called as the congenital hypoplastic anemia. So there is red cell hypoplasia. Okay, and these children are symptomatic in early infancy, or they might present with anemia at birth. Okay, and the anemia which you see is normochromic macrocytic anemia, and there is decreased reticulocyte count. So you should know that. Okay, so there is decreased reticulocyte count. So coming to the etiology, what is the gene which is affected? That is the RPS19. So this gene codes for a small ribosome subunit. Okay, and the inheritance is autosomal dominant. Okay, next. So very important is the clinical feature. So these children will have craniofacial abnormalities. Okay, so hypertelorism will be there. So now we'll just say hypertelorism will be there. Flat nasal bridge will be there. There'll be cleft lip. Or three micros you should remember is the microcephaly, micrognathia, microtia. Then they'll have low set ears. Then they'll have a low hairline. Okay, they'll have ptosis. So you should remember this, and a high arched palate. Okay, so this is a craniofacial abnormality. Next, coming to the ophthalmologic, so you can see that these children can have congenital glaucoma, they can have strabismus, they can have congenital cataract. Coming to the neck part, so these children have a short neck, they'll have a webbed neck. Okay, they can have sprangle deformity. So I've already said sprangle deformity. There is one side that is drooping, or the other side could be the shoulder would be higher than the normal side. So that is the sprangle deformity. Klippel-Feld deformity, what happens in the cervical vertebra? The cervical vertebra will be fusion of the cervical vertebra. Okay, so that is Klippel-Feld. So there is neck abnormalities that we should see. Next, coming to the thumb. So thumb, you should know it is the thumb has triphalangeal thumb. So very important. So they have only two phalanges, right? So they have triphalangeal thumb. So very important. Or the children can have a duplex or another set of thumb, or it could be bifid. Okay, hypoplastic. So sometimes it could be a rudimentary thumb. Fine. And another thing is, so all these are on the radial part of the hand. So next is a flat inner eminence. Next, there could be absent radial artery. So this you should know. Urogenital system, there could be absent kidney, horseshoe kidney, hypospadias, cardiac defects, BST, AST, coarctation of aorta, or they could be complex cardiac defects. Okay, other abnormalities include the growth retardation or the syndactyly. So syndactyly, what did I say? It is the fusion of the fingers. And very important, short stature. So you should remember short stature. Next, these are the pictures for hypertelorism and ptosis. In the first picture shows hypertelorism and ptosis. Okay. The second picture shows the fusion of the cervical vertebra, that is the Klippel-Feld deformity. And thirdly, the picture shows that abnormality in the shoulder. So you can see that one shoulder is raised higher than the other shoulder. So that is the feature of Sprengel deformity. Fine. So coming to the laboratory findings. So in a child, when you get a CBC anemia, there could be thrombocytosis, and very rarely there will be thrombocytopenia. Okay. So here there is only one line is affected. So in aplastic anemia, at least pancytopenia will be there. 3 lines will be decreased. So thrombocytopenia will be there. But here there won't be thrombocytopenia. Instead, there will be thrombocytosis. Okay. So the peripheral smear, when you get, it will be a normochromic macrocytic anemia. There is no hypersegmented neutrophils. So remember that. So hypersegmented neutrophils is a feature of megaloblastic body, right? Okay. Next, when you get the RBC enzyme, so you get a erythrocyte adenosine deaminase, that will be reticulocyte count will be low, right? Differential diagnosis, I have told you, it's a transient erythroblastopenia of childhood that I'll discuss. And the treatment of choice is corticosteroids. So this helps in improving the reticulocyte count. And once the reticulocyte count has improved, then you go for a low maintenance corticosteroid. But in patients who do not respond to corticosteroid, we require blood transfusion to see that their hemoglobin is above 8. So the problem with blood transfusion is iron overload. So you have to, yes, very good, Aparna. There will be decreased erythrocytes. Yes, that is another. That is why the reticulocyte count is decreased in these children. Okay, fine. So blood transfusion. The final cure is the hematopoietic stem cell transplant. Okay, so the transient erythroblastopenia of childhood, what happens? It is an acquired cause. Okay, it's an acquired cause. And another thing I forgot to tell over here, this here the theory is this erythropoiesis is suppressed because of immunoglobulin G. Immunoglobulin G, IgG, IgM, and cell-mediated mechanisms. Okay, so they say this is the reason there is suppression of the erythropoiesis. Okay, so you should know, and this is transient. So eventually it will become fine. Like in 2-3 months, the child will be fine. Okay, so this is seen in a normal who was previously a normal child and eventually developing anemia. So when you get a CBC, there will be the RBCs will be, there will be macrocytosis, there will be thrombocytosis, and 20% of these develop neutropenia. And the erythrocyte adenosine deaminase will be normal. There is no skeletal abnormalities, and the treatment is blood transfusion, following which the child should be normal. But the child requires recurrent episodes of blood transfusion. Then you have to think about other causes of anemia in this child. Okay, so now we will discuss again. So I know these topics are difficult. So again, we are going to revise. Okay. Okay, so first is Fanconi anemia. Washman-Diamond syndrome. Thirdly, dyskeratosis congenita. And finally, it's the Diamond-Blackfan syndrome. Okay, so the first 3 are pancytopenias, while the Diamond-Blackfan syndrome is the red cell aplasia. So tell me inheritance of Fanconi anemia. Okay, first you tell me the gene affected. Okay, gene affected. Gene. What is the gene affected here? So the gene affected is the FANC gene. So I have told you there is FANCA, FANCB, FANCC, FANC1, FANCD. So this is the gene which is affected. So this gene can cause the abnormality in this gene can cause, yes, very good. It can cause chromosomal breakage. Chromosomal breakage. So this is the last time I'm going to discuss all these. That is why I am doing this, because I don't want you all to forget. Okay. So chromosomal breakage. So chromosomal breaks will. Okay. Schwarzman-Diamond syndrome. What is the gene affected? Schwarzman-Diamond. Yeah. So the inheritance is autosomal recessive. Okay. We'll write it here. It's autosomal recessive. Tell me the gene which is affected in Schwarzman-Diamond syndrome. Remember and tell me. It is the SBDS gene. So I was telling you, remember this B as bad. So SDS is Schwarzman-Diamond syndrome. SBDS gene. Yes, very good, Aparna. SBDS gene. So what does these do? These will encode for a ribosomal biogenesis. Normally this gene does ribosomal biogenesis. Okay, very good. In the 7q11, very good. So this gene causes ribosomal biogenesis, which does not happen here. Fine. Okay, in the DKC, what is the gene which is involved? So there are a lot of genes. Okay, and the inheritance is what in Schwarzman-Diamond syndrome? The inheritance is autosomal recessive. So the genes are a lot. Very good, Aparna. Very happy you are remembering. So in dyskeratosis congenita, what is the gene affected? So in dyskeratosis congenita, okay. The dyskeratosis congenita, the gene which is affected is, so DKC1 gene is 1 because it causes X-linked, yes. So X-linked recessive. Over here there is DKC1 gene is affected. So then there is autosomal dominant and autosomal recessive inheritance as well. So the gene which affected causes the, they affect the telomere complex. Telomere complex. So telomere complex is affected. Okay, is affected. Fine. So now coming to the diamond Blackfan syndrome. So what is the gene affected? So yes, very good, very good. So what is the gene which is affected in diamond Blackfan syndrome? I just told you all. So RPS19 gene is affected. RPS19. So this gene codes for a small subunit of ribosome. Okay, it codes for small subunit of ribosome. So can you all see both the diamonds? So this is Schwarzman diamond and the diamond Blackfan. Both are, yeah, both have abnormalities in the ribosome. Okay, both the diamonds have an abnormality in the ribosome. Okay, so you can see RPS. So you can think as a ribosome protein. You can remember like that. Okay, so RPS19 gene affects the small subunit of the ribosome, and the inheritance is autosomal dominant. Okay, so I think I'm hoping you all know the clinical features. Okay, clinical features. So now tell me, um, yeah, which anemia out of these four, which has a high chance of developing malignancies due to human papilloma virus? Which out of these has a chance of going into development of human papilloma of cancer due to human papilloma virus? Out of Fanconi anemia, Shortman-Diamond syndrome, or anemia, DKC, dyskeratosis congenita, and Diamond-Blackfan syndrome, which can go into cancers due to human papilloma virus, which is a high etiology, and as a result, once you diagnose this disease, you have to very good this Fanconi anemia. So Fanconi anemia has affection to human papilloma viral uh, cancers. Very good. Okay, next, Okay, tell me what is the skeletal abnormality in Schwarzman-Diamond syndrome? So what is the skeletal abnormality in Schwarzman-Diamond syndrome? So over here, there is not much abnormality in the Schwarzman diamond syndrome. So basically, you can see there is thick and short ribs. There is thoracic dystrophy. There is short stature. There is metaphyseal dysplasia. So not much over here. So you don't have to worry. They'll come with short stature. So remember short stature only. Okay. While the thumb is affected in the Fanconi anemia, thumb abnormalities in Fanconi anemia and the Diamond Blackfan syndrome, thumb abnormalities, right? So kidney is affected. So kidney is affected in all. Okay, kidney is affected in all of these except Schwarzman diamond. So that would be mild. Fine. So this much you should know. And yeah. So in the Fanconi anemia, very important is the chromosomal breakage test. So this we have discussed that day. So breakage test. So when you put an agent, that is the diepoxybutane, that is D, or the mitomycin C. So DEB or mitomycin C. Add that into the lymphocyte culture of a Fanconi anemia patient, there will be chromosomal breakage. Remember that. And tell me what is the treatment? Treatment here. What are the drugs which are used? One is hematopoietic stem cell transplant. So what is the drug which is here? So the drug which is used is androgens. Remember, androgens. So androgen is used here and in the dyskeratosis congenita. So tell me some clinical features of dyskeratosis congenita. Tell me some clinical features of dyskeratosis congenita. I've told you all there's a triad you all should remember. There's a triad you all should remember. There is skin. Okay, there is skin involvement. Then there is leukoplakia and there is nail dystrophy. Ocular involvement is there. There is uh, yeah, there is epiphora. Yeah, the triad is the skin. There is hypopigmentation. There is mucosal leukoplakia. There is nail dystrophy. So everything related to the skin and the keratin is there in the dyskeratosis congenita. So you should remember that. So the three androgens are also used in dyskeratosis congenita. Azathioprine, no. So Aparna, there is no azathioprine here. Okay, do not confuse. No azathioprine. Okay. So in Schwarzman Diamond syndrome, the main presentation, what is the main presentation? There is pancytopenia with. When this is there, then it is for sure Schwarzman Diamond syndrome. What is it? So tell me, what could it be? In Schwarzman Diamond syndrome, very important feature. So in Schwarzman Diamond syndrome, yes, very good Aparna. There will be pancreatic insufficiency. So insufficiency, very important. Yeah, both Ganesh and Aparna, very right. There is pancreatic insufficiency. So because of pancreatic insufficiency, the treatment involves you have to give pancreatic enzyme replacement. You should give fat soluble vitamins in these patients. Also, next final treatment is these children will have severe neutropenia. Remember, I have told you in these children there is neutropenia. The neutrophils have abnormality in their addition, there is abnormality in their mobility. So these will have neutropenia, and as a result, you have to, as a treatment, you have to give GCSF. So this GCSF, what will it do? It will stimulate the production of neutropenia. But very important is these patients have they have prediction they have affection to develop which cancer, Schwarzman Diamond syndrome, which cancer? Schwarzman-Diamond syndrome develops which cancer? They have higher chance of developing leukemia and myelodysplastic syndromes, while Fanconi anemia has a higher chance of developing squamous cell carcinoma. Squamous cell carcinoma, especially, or solid tumors, especially of the head. Very good, Aparna. Schwarzman diamond is leukemia. So, Fanconi anemia more common, say squamous cell carcinoma, solid tumors of the head, neck, upper esophagus. Eventually, it can lead to carcinoma of the cervix. Okay, while Schwarzman-Diamond syndrome is more of MDS, that is myelodysplastic syndrome. While the dyskeratosis congenita has both predilection to solid tumors as well as leukemia and myelodysplastic syndrome. Right? Very good. So in Diamond-Blackfan syndrome, they have a high chance of developing which cancer? Which cancer? Acute myeloid leukemia. So the treatment here is corticosteroids. Fine, done. So we are done. So I feel this is this in this most of it is this. So if you are making notes, you'll have to make notes like this and keep some space at the end so that if there is anything new, you all can add on to it. So a note should be like that so that you can finish it in one go. So there are 4 diseases involved in this one slide. So this is how your note should be, so that it will be very easy for you to revise. Okay, and you should color some important points. You should color with, so like for example, sorry, one second. So, for example, now if for example if want to, so you have to underline. So this is HPV cancers are common in Fanconi anemia, so underline like that. So underline whatever is very important. So use various colors to underline so that you can pick. So you have to keep that each color has certain importance. Okay, so that will help you to revise better. So this is how you should make your notes. Fine. So very good. I'm very happy. So you all remember everything in this thing. There is no one thing about azathioprine is no azathioprine. Azathioprine only in, no it has not been used in any of these. Okay. So androgen is for Fanconi anemia and dyskeratosis congenita. Filgrastim, that is the granulocyte colony stimulating factor, is used even in Fanconi anemia, but it is more used in Schwarzman-Diamond syndrome because there is a neutrophil abnormality in these patients, right? Okay, and corticosteroids are used in Diamond-Blackfan syndrome. So I'm very happy to have you all have understood these few topics, and fine. So we are done for today. So tomorrow I'll be discussing about hematopoietic stem cell transplant. So we'll do a detailed thing, and if it is going to be a very short topic, along with that I will add another small topic with it. I don't know because or I will do certain acquired causes of pancytopenia. Let's see, acquired causes of pancytopenia. So we'll see. I'll have to check how is the how big is the topic. So it should be a very short topic. So yeah, okay. So we'll do this. So this is for tomorrow. That is 14th. 14th. Sorry about 7. 14/7/2020. On Wednesday, that is on 15th, I will be having a quiz. So this quiz, I will try to include all the topics, but I might, because this topic has been very vast. Okay, so the quiz should be such that so you all should be able to revise also, so that whatever you have listened to me in the last 1 to 2 weeks, the quiz you should be helpful to remember also. So I will see that maybe I will do half of the anemia on Wednesday, and on Thursday I'll keep a class on polycythemia. Okay, polycythemia, that is on 16th, and that will be followed by on 17th by another quiz. So the remaining topics which I wouldn't have completed in the previous quiz will be on in this quiz. Okay, 17th, because I have to do few discussions. So only if I discuss with you all will remember. Okay, so on 17th. After that, from 18th, so this will be Wednesday, Thursday, Friday. Yeah, so on 18th, I'll be having a class on approach to bleeding disorders. Approach to bleeding disorders. Okay, approach to bleeding disorders. Then on 19th is a Sunday, so there is no class that day. 20th, there will be hemophilia. So hemophilia, the von Willebrand syndrome and everything I will try to cover here. 21st, idiopathic thrombocytopenic purpura. Okay, and 22nd, there will be thrombotic disorders. And then other topics, I don't remember the dates. So there will be a quiz related to these diseases. Then there will be one class on lymphadenopathy and another class on splenomegaly. Okay, so these will be the classes for YouTube. So by the end of this month, you will be done with hematology. Okay, so this hematology is a very important topic. So this will, even if you're reading a topic from an adult, medicine topics also, it will help you to correlate better. So these were the topics. So today at 4 p.m. I'll be discussing Takayasu arteritis. Okay, so I'll do alternate days, these special classes in Unacademy, special classes, alternate day. One will be Takayasu arthritis. Next on on Wednesday I will do arteritis nodosa. Okay, there will be polyarthritis nodosa. And do you all want me to do this polyangiitis? If you want me to do polyangiitis also, I will add in the one of the class. I'm not sure about this. So if you all want me, Church-Strauss syndrome and all comes under this. Okay, Church-Strauss syndrome comes under this. So if you all want me to discuss, I will discuss this. Or else Takayasu arthritis, polyarthritis nodosa. So what about these topics? Amyloidosis, sarcoidosis. Do you all want me to discuss these topics? Do you all want me to discuss amyloidosis, sarcoidosis? Okay, so I will discuss polyangiitis. Then what about amyloidosis and sarcoidosis? Okay, so if it's not important, I will not discuss these topics. Another topic is I have not done this Behcet disease and Sjogren's disease, Sjogren's syndrome. So these two topics I will complete. So with the completion of this, you will be done with all the rheumatologic disorders in childhood. Okay. So in that, so once I finish all these topics, I will have a quiz. I will have a quiz which includes all the rheumatological disorders. Okay, so that will help you to revise. So by this month, you will be very sure with rheumatological disorders in your childhood and hematological disorders. So these two topics will be the tip of your fingers. Okay, so very good. So I'm very happy you all remembered all what I've taught in previous classes. Okay, so very important. Every time, as I say, so study daily. Do not have a break in your studies. Even if you have a break, if you want to have a break, study for at least 1 hour that day. Secondly, avoid social media. It will waste a lot of time. So GIT I have done, Aparna. GIT I've already done in this YouTube class. Just go and see. Want anything else? I will take a class on that. GIT is done. Okay. Okay, so avoid social media. Thirdly, sleep early, wake up early. It helps to remember better. And fourthly, if you have any study partner, half an hour you discuss the topics with them, so it will help you to remember better. Okay, so these are the things I always tell. And see, continuously sitting and reading is not possible. So 3 hours to study, go out, take a walk for half an hour and all that. That will help you again, get back the concentration to study. Okay, and next is very important. If I have to be in this platform for a long time, then you have to use my code Shilpa 10 to subscribe to the subscription, or else I might not be able to be in this platform. Okay, so Shilpa 10 is my subscription code. Using my code, you get a 10% discount. Okay, and yeah, so stay healthy, stay safe, and study daily. Okay, good luck for your exam. And thank you, Aparna and Ganesh, for attending the class.